Hello, my name is Mace, and I'm a volunteer with SHINE, which is an acronym for Servicing Health Insurance Needs of Elders. And on behalf of myself, SHINE, Elder Source, and the Department of Elder Affairs, we welcome you to today's presentation of Medicare Part C, Medicare Advantage Plans. Online meeting etiquette. Please familiarize yourself with the Zoom menu options. Please hold any questions, and with time permitting, I will be glad to answer them for you at the end of the presentation. Friendly reminder. Please speak clearly and avoid using inappropriate language. Maintain a polite and respectful tone. Thank you. Elder Affairs. SHINE is a program of the Florida Department of Elder Affairs, DOEA. The SHINE program is part of the nationwide State Health Insurance Assistance Programs, SHIP. There are SHIP programs in all 50 states and 4 U.S. territories. The Florida Department of Elder Affairs receives annual funding for the SHINE program from a federal SHIP grant. The Florida Department of Elder Affairs vision is for all Floridians to live well and age well. SHINE's mission is to provide free and unbiased health insurance counseling through a dedicated network of volunteers, empowering Florida seniors to make informed health care choices. Disclaimer. SHINE is a free program offered by the Florida Department of Elder Affairs in partnership with your local Aging and Disability Resource Center. Specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. SHINE services are free, unbiased, and confidential. SHINE is not affiliated with and does not endorse any insurance company or product. Area Agency on Aging, AAA. The Department of Elder Affairs administers programs and services for elders through contract agreements with the 11 Area Agencies on Aging, AAA, in Florida. The AAAs are independent, not-for-profit organizations responsible for ensuring the availability of services to all elders in Florida. The SHINE program contracts annually with the Aging and Disability Resource Centers to provide counseling services locally. SHINE counselors. The primary duty of volunteer SHINE counselors is to help Florida seniors identify, understand, compare, and/or enroll in original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance, Medigap, low-income subsidy, extra help for prescription costs, Medicare savings programs. SHINE counselors also provide counseling for long-term care planning and assist clients with Medicare complaints and appeals. Through the SMP grant, SHINE counselors can provide education on Medicare fraud and abuse, including how to prevent yourself from fraud, how to detect fraud, and how to report fraud. Medicare Part C topics. During this presentation, you may hear the acronym MA, which stands for Medicare Advantage. What are Medicare Advantage plans? Understand the Medicare paths. Here is a graphic showing the Medicare basics paths. 2 paths to Medicare. Original Medicare or Medicare Advantage. Path 1, original Medicare coverage. Part A, hospital. Part B, medical. Path 1, original Medicare optional coverage. Medigap, Medicare supplement. Part D, prescription drug coverage. Path 2, Medicare Advantage coverage. The alternative path for Medicare coverage is Medicare Advantage, started in 1997. Part of the Medicare program, it is also known as Medicare Part C, MA, MA-PD, or Medicare Health Plans. Advantage plans are approved by Medicare and offered throughout the country by private companies that sign a contract with Medicare. Each month, Medicare pays a set amount of money to these health plans for their members' health care. This is called a capitalization rate. Path 2, Medicare Advantage cost. If you join a Medicare Advantage plan, you must continue to pay the monthly Medicare Part B premium. Note, everyone is charged a monthly Part B premium because the low Social Security cost of living adjustment, COLA, a statutory hold harmless provision designed to protect seniors, will largely prevent Part B premiums from increasing for most beneficiaries. Income-related premiums are based on the modified adjusted gross income as reported on your IRS tax return from 2 years ago. There may be other costs you may pay to the plan, such as additional monthly premiums. You pay deductibles, coinsurance, and co-payments. Out-of-pocket costs are different from original Medicare. Varies from plan to plan. Costs may be higher if you go out of network. Eligibility and enrollment. In this section, we will discuss eligibility and enrollment, covering questions like when can you join or switch plans? Who can join? Who can join an Advantage plan? Medicare Advantage plans are available to most people with Medicare. To be eligible to join a Medicare Advantage plan, a person must be enrolled in Medicare Part A and Part B, live in the plan's geographic service or continuation area. People with end-stage renal disease, ESRD, usually cannot join a Medicare Advantage plan or other Medicare plan. However, there are some exceptions. If ESRD is developed while enrolled in an MA plan, a person may continue to be enrolled in the MA plan. Some Medicare Advantage special needs plans accept people with ESRD. A person who receives a kidney transplant and who no longer requires a regular course of dialysis is not considered to have ESRD for purposes of MA eligibility. To join an MA plan, a person must actively enroll, as enrollment in Advantage is not automatic. The beneficiary must also agree to provide the necessary information to the plan, agree to follow the plan's rules, and belong to only one Medicare Advantage plan at a time. When can I enroll in an Advantage plan? Since Advantage plans are part of Medicare, one may enroll only during an official Medicare enrollment period. However, there may be cases when a beneficiary may qualify for a special enrollment period or SEP. Medicare enrollment periods. Initial enrollment period. This is when most people first become eligible for Medicare. This is a 7-month period which begins 3 months prior to your 65th birth month. You can elect either Original or Medicare Advantage. Open enrollment period. Every year, Medicare provides the opportunity to change your Medicare coverage. It is only for those who are already enrolled in Medicare. It runs from October 15th through December the 7th, with coverage starting the following January 1st. One can switch between Original and Advantage, change from one Advantage plan to another, or just change drug coverage. Medicare enrollment periods. These are the most common special enrollment periods. Working aged. This SEP is for those who declined Part B when first eligible because they were covered by their or their spouse's employer group coverage. When the employment or coverage ends, whichever is first, this SEP begins. 8 months to enroll in Part B, 2 months to enroll in Part D through an Advantage plan or standalone. Move to a new address. When you change your permanent address, you will need to check with your plan to see if you have also moved out of your plan's service area. If so, Medicare allows an SEP for this transition. You also have a SEP if you move within your current plan's service area, but more plan options are available in the new location. Plan leaves Medicare program. A company may choose to no longer participate or may have its contract terminated by Medicare. Involuntary loss of creditable coverage. If you lost coverage that was as good as Medicare creditable coverage, or the plan changes and is no longer considered creditable coverage, you may qualify for an SEP. Upgrade to a 5-star plan. If you are in a plan rated below 5 stars and a 5-star plan is available in your area, you may upgrade from your current plan to the 5-star plan once during the calendar year. General enrollment periods. This period is for those who did not enroll in Medicare when they first became eligible and do not qualify for a special enrollment period. You may enroll in Part A and Part B from January 1st to March 31st. Then you may switch paths by enrolling in Advantage or stay in Original Medicare path and add a Part D plan. MA open enrollment period. Leaving a Medicare Advantage plan. If a person is in an MA plan and wants to return to Original Medicare, they may disenroll from the plan during the MA open enrollment period. This period is from January 1st to March 31st. If you go back to Original Medicare during this time, plan coverage will take effect on the first day of the month following the date on which the election or change was made. To disenroll from an NA plan and return to Original Medicare or switch to a different Advantage plan during this period, you can make a request directly to the MA organization, call 1-800-Medicare. If you make this change, you may also join a prescription drug plan, Part D, to add drug coverage. Coverage begins the first of the month after the plan gets the enrollment form. Trial right. When Medicare beneficiaries choose the Medicare Advantage path for the first time, they are eligible for a trial right. Examples include enrolled in Advantage plan during the initial enrollment period at age 65. Enrolled in Original Medicare when first eligible, and enrolled in Advantage for the first time during the most recent open enrollment period. The trial right allows the beneficiary to disenroll from Medicare Advantage plan during the first 12 months of coverage, return to Original Medicare, pick up a standalone prescription drug plan, and have the guaranteed issue right to purchase a Medigap supplement policy if they had one prior to joining the Medicare Advantage plan. MA plan types. Medicare Advantage plans can vary. We will review the different types of plans offered. Remember to read individual plan materials carefully to make sure you understand the plan rules. You may want to contact the plan to find out if the service you need is covered and how much it costs. Health Maintenance Organization, HMO. These are the general rules for how Medicare HMOs work. In Medicare HMOs, the copayment or coinsurance amounts a member pays for services received are set by the plan. There are doctors and hospitals that contract with the plan, called the plan's network. People generally must get their care and services from the plan's network. People who get health care outside of the plan's network may be required to pay for these services themselves. In most cases, neither the Medicare HMO nor the original Medicare plan will pay for these services. Call or get a list from the plan to see which doctors and hospitals are in the plan's network. Even if you see your doctor on the list, it's a good idea to contact your doctor to verify before enrolling in the plan. The service area is where the plan accepts members and where plan services are provided. Members are covered if they need emergency or urgently needed care and aren't in their HMO's service area. People who join a Medicare HMO plan may be asked to choose a primary care doctor. They usually need a referral to see a specialist, such as a cardiologist. Depending on their contract, doctors can join or leave an HMO's network at any time. When a primary care doctor leaves an HMO, the plan will notify their patients, generally 30 days in advance, and provide an opportunity to pick a new doctor. Most Medicare HMO plans cover prescription drugs. If you want an HMO and prescription drug coverage, Part D, you must join an HMO plan that offers prescription drug coverage. If you join an HMO plan that does not offer prescription drug coverage, you cannot join a standalone Medicare prescription drug plan. HMO, point of service, HMO-POS. HMO point of service plans provide some coverage outside of the HMO's network. Many like to think of HMO-POS is a combination of HMO and PPO plans. Preferred Provider Organization, PPO. People in a PPO generally can see any doctor or provider who accepts Medicare. They do not need a referral to see a specialist or out-of-network provider. Every Medicare PPO plan must cover all services received out of network, but every plan is different in what their members must pay. The out of network charge may be up to 100%. Most Medicare PPO plans cover prescription drugs. If you want a PPO and drug coverage, you must join a PPO plan that offers prescription drug coverage. If you join a PPO plan that does not offer prescription drug coverage, you cannot join a standalone Medicare prescription drug plan. Private Fee for Service, PFFS. A Medicare PFFS plan is a type of Advantage plan offered by private insurance companies. Each plan determines how much it will pay doctors, other healthcare providers, and hospitals, and how much you must pay when you get care. Some PFFS plans contract with a network of providers. Out-of-network doctors, hospitals, and other providers can decide not to treat you even if you have seen them before. For each service you get, make sure your doctors, hospitals, and other providers agree to treat you under the plan and accept the plan's payment terms. In an emergency, doctors, hospitals, and other providers must treat you. You only need to pay the copayment or coinsurance amount allowed by the plan for the type of service you get at the time of the service. Beneficiaries can get Medicare prescription drug coverage from the private fee-for-service plan if offered. If it is not offered, they can also join a standalone Medicare prescription drug plan. Special Needs Plans, SNP. Special need plans are designed to provide focused care management, special expertise of the plan's providers, and benefits tailored to enrollee conditions. For example, a special need plan for people with diabetes might have additional providers with experience caring for conditions related to diabetes, have focused special education or counseling, and or nutrition and exercise programs designed to help control the condition. A special needs plan for people with both Medicare and Medicaid might help members access community resources and coordinate many of their Medicare and Medicaid services. All Medicare special needs plans must include Medicare prescription drug coverage. There are three categories for a Medicare special needs plans. For people with certain chronic or disabling conditions, those eligible for both Medicare and Medicaid, and people in certain institutions, such as a nursing home, Medicare special needs plans are only available in certain areas. What are the eligibility requirements for SNPs? Dual eligible SNP, D SNP. You're eligible for both Medicare and Medicaid. Some DSNPs may provide medical services in addition to Medicare services. DSNPs contract with your state Medicaid program to help coordinate your Medicare and Medicaid benefits, depending on the state and your eligibility. Chronic condition SMP, C-SMP. You have one or more disabling chronic conditions. Institutional SNP, ISNP. You live in the community but need a level of care a facility offers, or you live or expected to live for at least 90 days straight in a facility like a nursing home, intermediate care facility, skilled nursing facility, rehabilitation hospital, long-term care hospital, swing bed hospital, psychiatric hospital, or other facilities that offer similar long-term healthcare services and whose residents have similar needs and healthcare status as residents of the facilities listed above. Medicare Savings Account Plans, MSA. MSAs have two parts. Part 1 is a special type of high deductible Medicare Advantage plan, Part C. The plan will only begin to cover your cost once you meet a high yearly deductible, which varies by plan. Part 2 is a special type of savings account that Medicare deposits money into. The amount of the deposit varies by plan. The funds in the Medicare medical savings account may be used to pay healthcare costs, including costs that aren't covered by Medicare. If these funds are used to pay for medical expenses, the money is tax-free, and if you are paying for Medicare-covered Part A and Part B services, payments count toward your plan's deductible. Money left in your account at the end of the year stays in the account and may be used for healthcare costs in future years. Note that if you use all the money in your account and you have additional healthcare costs, you'll have to pay for your Medicare covered services out of pocket until you reach the plan's deductible. During this time, doctors and other providers can't charge you more than the Medicare approved amount. Once you reach your deductible, your plan will cover your Medicare covered services. This plan requires a special tax form and is very rare. You can't join an MSA plan if any of these apply to you. You have health coverage that would cover the Medicare MSA plan deductible. This includes benefits under employer or union retiree plans. You joined another Medicare Advantage plan. You get benefits from the U.S. Department of Defense, TRICARE, or the VA. You're a retired federal government employee and part of the Federal Health Benefits Program, FEHBP. You are eligible for Medicaid. You are currently getting hospice care. You live outside the U.S. more than 183 total days a year. U.S. distribution of Medicare Advantage enrollment by plan type 2010 through 2024. In 2024, nearly 2/3 of Medicare Advantage enrollees are individual plans that are open for general enrollment. More than 6 in 10 Medicare Advantage enrollees, 62%, or 20.5 million people, are in plans generally available to all beneficiaries for individual enrollment. This is an increase of 0.9 million enrollees compared to 2023. Individuals plans have declined as a share of total Medicare enrollment since 2010. In Florida, 60% or more of all Medicare beneficiaries in the state are enrolled in Medicare Advantage plans. Medicare Advantage considerations. There are certain considerations regarding current and future coverage that you should look into before choosing a Medicare Advantage plan. MA rights and protections. All people with Medicare have certain guaranteed rights and protections. You have these rights and protections whether you are in Original Medicare, in a Medicare Advantage plan, or another Medicare plan, have a drug plan, or have a Medigap policy, supplement insurance. Rights and protections. How MA plans work. It's important to note that people who join a Medicare Advantage plan or other Medicare plan still have Medicare rights and protections, and if the plan decides to start participating in Medicare, you may join another Medicare health plan or return to Original Medicare. Guaranteed rights for Medicare beneficiaries. This graphic shows some of the guaranteed rights for Medicare beneficiaries. Additional rights for MA beneficiaries. You have the same rights and protections as all people with Medicare. You also have the right to choose health care providers within the plan. Get a treatment plan from a doctor. If you have a complex or serious medical condition, a treatment plan lets you directly see a specialist within the plan as many times as you and your doctor think you need. Women have the right to go directly to a woman's health care specialist without a referral within the plan for routine and preventive health care services. You know how your doctors are paid. When you ask your plan how it pays its doctor, the plan must tell you. Medicare doesn't allow a plan to pay doctors in a way that could interfere with you getting the care you need. Request an appeal to resolve differences with your plan. File a complaint, call a grievance, about other concerns or problems within your plan. Get a coverage decision or coverage information from your plan before getting services. To learn more about your rights and protection, read your plan's membership materials or call your plan. Marketing guidelines. All Medicare plans, whether they are Medicare Advantage plan or prescription drug plan, must adhere to strict marketing guidelines. Failure to do so could result in a fine or other actions. All marketing materials, such as brochures, flyers, and other items, are pre-approved by Medicare. Details regarding plan coverage and services provided are given at the time of enrollment and annually by means of the annual change of notice, ANOC, or an evidence of coverage notice. Plan sales agents may not knock on your door, cold call you before or after sales event, and they may not email you or approach you in areas such as hallways, lobbies, sidewalks, or parking lots. During marketing the Medicare Advantage plans, organizations may not include annuities, life insurance, or other products. Marketing guidelines. Organizations may There are occasions when an organization may contact individuals, such as when you gave a plan or sales agent permission to contact you, may offer a gift to potential employees at events if such gifts are of nominal value, less than $15, and are provided whether or not the individual enrolls in the plan. Gifts cannot include a free meal during sales pitch. They may contact their members who are eligible for extra help and assist you with application for cost savings benefits. These types are calls are pre-approved by Medicare. Organizations may call existing members to conduct business related to enrollment in the plan. They may also call former members after they have disenrolled from the plan to conduct a survey for quality improvement purposes. Medicare.gov Plan Finder. The internet is full of information about Medicare, but not all of it is accurate. Medicare.gov is the official website for Medicare and has the most up-to-date information. The information contained on this site is deemed accurate and reliable. Like most websites, the layout and appearance of this site may change in the future as it is updated by CMS. The Medicare.gov Plan Finder allows anyone to search and compare available Medicare plans in their area based on the entry of general information, zip code, or within a personal account. When logged in, there are online chat guides to help with questions or seek a Shine counselor to help with the plan comparisons. Financial assistance programs. Shine handout. This helpful Shine fact sheet lists eligibility requirements for financial assistance programs for which Shine counselors may help beneficiaries apply and can be obtained by calling your local Shine office. Medicare Savings Programs, MSP. The Medicare Savings Programs are designed to have individual states pay for eligible Medicare beneficiary out-of-pocket cost. The programs are jointly funded through state and federal finances. The QMB, SLMB, QI1, and QDWI programs are collectively known as the Medicare Savings Programs, MSP. There are several benefit levels in the program that are based on individuals' income and resources. We will review these levels in a moment. Application assistance is available at the state level through the Department of Children and Families, DCF. Limited benefits are based on eligibility and include Medicare Part A and Part B premiums, deductibles, co-insurances, and co-payments. Extra help with prescription drug cost. Extra help, also known as the Low Income Subsidy or LIS, designed to help eligible Medicare beneficiaries with the cost of prescription drugs only. It's administered by the Social Security Administration, and like the Medicare Savings Programs, eligibility is determined by certain income and resources. Certain people automatically qualify for extra help and do not need to apply. These include people with Medicare and full Medicaid benefits, including prescription drug coverage, referred to as dual eligible. People with Medicare who get supplemental security income, SSI benefits, but not Medicaid. People who are enrolled in a Medicare savings program. People who meet their medically needy share of cost at least once during the calendar year in Florida. People who qualify still need to join a Medicare drug plan to get extra help paying their prescription drug cost. If they don't join a plan on their own, Medicare will enroll them in a plan to ensure they have coverage. Medicare will send them a notice telling them what plan they are in and when their coverage begins. They may switch to a different plan of their choosing once per quarter. Other people with Medicare should file an application with the Social Security Administration to find out if they qualify for extra help. They can apply with the Social Security online at ssa.gov. Medicare, fraud and abuse. Medicare, fraud and abuse. Fraud is purposeful. Abuse is a mistake. The difference between fraud and abuse is intent. 3 steps to prevent healthcare fraud. So, what can you do to take charge and help prevent Medicare fraud, errors, and abuse? 1. Consider ways to prevent yourself and others from becoming Medicare fraud victims. 2. Detect Medicare fraud and abuse. Even when you do everything right, there is a chance that you could be a target of healthcare fraud. 3. If you detect or suspect fraud or abuse, report it. You will protect other people from becoming victims and help to save your Medicare benefits. 3 steps to prevent healthcare fraud. Prevent. Here are some tips to protect yourself from healthcare fraud. Treat your Medicare card like you would a credit card. Only share Medicare cards and numbers with trusted sources who need that information to serve you, i.e., doctors and pharmacies. Do not rely on advice or offers from unknown persons who call, visit, or approach you in public. Never sign a blank medical or insurance form. Detect. Medicare sends you 2 notices with your claim information. The two notices are the following: Medicare Summary Notice, MSN, and Explanation of Benefits. These notices allow you to review your Medicare claims and check for possible mistakes. Report. If you see something unusual on your MSN, check with your plan or call Shine. If you get a call from someone requesting your Medicare number, do not give it out. Call the Federal Trade Commission at 877-382-4357 and your local law enforcement. If you believe you are a victim of fraud or abuse, contact your local law enforcement and Shine for more information. Red flags on an MSN. Your Medicare Summary Notice, or MSN, is a very useful for detecting fraud. Let's review the 5 highlighted sections that will help you check for fraudulent Medicare charges. Number 1, your visit. This section provides information like the date you went to your doctor. Keep your bills and compare them to your notice to be sure you got all the services listed. Number 2, service descriptions. User-friendly service descriptions will make it easier for you to know what you were treated for. Number 3, approved column. This column lets you know if your claim was approved or denied. Number 4, max you may be billed. This is the total amount the provider is able to bill you. It's highlighted and in bold for easy reading. Number 5, this section refers to explanations of your services as listed at the bottom of the page. Next, let's look at the sections highlighted in red for examples of what to specifically check for. Is this a provider you know? Did you receive services on this day? If you live in Connecticut, did you really receive services in Ohio? Do any services appear twice when they shouldn't? Questions or comments? Please hold any questions or comments until the end of the presentation, and with time permitting, I'll be glad to answer them for you. Shine. Shine counselors offer free and unbiased assistance to help seniors identify, understand, compare, and enroll in Original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance policies, Medicare prescription drug low-income subsidy, Medicare savings programs, long-term care planning, insurance, and financing, and other public and private health insurance. Contact your local Shine program. The Senior Resource Alliance is located at 3319 McGuire Boulevard, Suite 100, Orlando, Florida 32803. The phone number is 407 514 1800. Tell us how we are doing. Please complete a short survey at the URL listed here, tinyurl.com/survey for Shine, and tell us how we are doing. End of presentation. Lastly, on behalf of myself, Shine, Elder Source, and the Department of Elder Affairs, we appreciate your time and participation in today's presentation. We hope that this presentation has provided an insight into becoming better educated and assists you with your Medicare endeavors.